Hi, I'm Sarah Kozlowski. I wrote my paper on the issue of policy and advocacy for vulnerable and underserved populations. I focused my paper specifically on the transgender population. And I did this because the transgender community faces many difficulties in obtaining proper health care. To define this population, they are an individual who does not identify as the gender they were thought to be at birth. So a trans man is someone who is believed to be female at birth, but now identifies as male, and the opposite. In my research, I also included non-binary individuals who do not exclusively identify as one or the other gender. I think a lot of this information can apply to all underserved and vulnerable populations because they all face stigmatization and health disparities. But this information is specifically geared toward the transgender community. 1.6 million individuals over the age of 13 identify as transgender, and that's as of 2022 data. And 1 in 6 transgender individuals live in a rural area. Thought this was interesting because our focus for our program is rural practice for nurse practitioners. And I think the rural population does have some interesting um, difficulties in obtaining care. It's not as easy to see a specialist or anything like that. In a survey completed in 2016, 23% of respondents who are transgender report avoiding healthcare due to negative experiences. They often report feeling a lack of connection to providers, and they also report many providers using microaggressions on them, if not outright inappropriate questions and comments. There is one report of an individual saying a provider asked when she planned to stop practicing homosexuality. And another said that a provider asked them really inappropriate questions about what kind of sex the patient prefers, which is not necessarily appropriate at the time. The transgender community often feels on display and not taken as who they are. Often providers will dead name transgender individuals, in which they use the person's former name and former gender for which they no longer identify. And that is very offensive and very difficult. The lifetime suicide attempt rate for the transgender community is 10 times higher. And one thing that they found a lot of people say is that the transgender patients want to be seen as an individual, and they don't want to carry the label of trans throughout their healthcare career. That's not exclusively what they want to be seen as. This is important for advocacy because there are currently 15 states with restricted access to gender-affirming care for minors, and 95 bills are currently in the process related to LGBTQ rights in 2023. I know in the state of Kentucky, we are currently trying to pass a Don't Say Gay bill, and there's also a bill related to gender affirming care. And while the Don't Say Gay in schools is not necessarily healthcare related, it does create a greater stigma for the transgender community. There's some plans that would be helpful for providers. The first is Rivera's Gender Affirming Therapy, which was developed in 2022, and it's the first to establish a middle grade theory for transgender care. It asks the provider to make a shift from gender binary care to gender affirming care. And It doesn't just ask for the provider to work to provide competent gender affirming care. It asks for the nurse practitioner to work for the elimination of social struggle and oppression via the perspective of the oppressed. So you're not looking at the issue through your lens, you're looking at the issue through the lens of those that are oppressed. The nurse practitioner, when utilizing this theory, needs to do a constant reevaluation of their own self biases and get further education on gender transition and gender affirming care. As an overall theme, most people remark that they do not have the education in gender affirming care or proper care for transgender individuals. So, over and over, I have seen that continued education and advocating for better education to care for this population and to care for them appropriately is very important. Being a nurse practitioner, we also have the ability to use our leadership skills and practice to encourage our areas to have gender appropriate forms and to use the pronouns and the terms that our patients request. Another thing that has come up is fragmented care. And I think this is important when considering the rural environment because often providers are more spread out and it's harder for patients of any population to get to multiple provider locations. So, considering the transgender individuals, trying to get care together and have all the providers as close together, whether through telehealth, is really important. Another aspect that many transgender individuals suggest is having an individual there that is an advocate for their patient, somebody who can speak for their needs and share their experience without the provider having to rely exclusively on the patient for that information. The patient wants to be seen as a unique individual, but does not want to be relied on for all educational needs. There's a great deal of information here. I think it's important when you are caring for this population to make sure that you are treating them as an individual, treating them as they wish to be named and called, and also advocating in your community for fair and equitable health care for all individuals, especially transgender individuals.